Welcome to Bariatric Psychology. This presentation is a mandatory part of the bariatric patient pathway before you undergo bariatric surgery. The presentation will introduce you to the bariatric psychology team, tell you a little about what we do, and describe the psychological risks related to surgery. We also aim to prepare you for successful weight loss by highlighting some useful ways of coping with the challenges of lifelong lifestyle changes that can help you stay healthy. The bariatric psychology team at Berkshire NHS Trust is made up of Dr. Ildiko Ridley, lead clinical psychologist, and Dr. Hannah Reville, clinical psychologist. We form a highly specialist clinical health psychology service. You might be wondering why you are asked to attend a psychological presentation before a surgical procedure. Surgery only works on the stomach, but psychological changes are also needed for successful weight loss. After the operation, you can only ensure ongoing weight loss by making long-term changes in your lifestyle. We will highlight the potential challenges throughout this process and help you work out strategies to deal with them. Our aims are to make the process of surgery and subsequent period as easy and safe as possible for you. We want to help you make changes that are vital for making your surgery a success. Bariatric surgery gives you a window of opportunity in which you can create new, helpful habits. We aim to give you strategies to maintain a healthy weight and lifestyle that you can maintain for the rest of your life. So what does the bariatric psychology team do? Firstly, we provide information and support before and after surgery about the psychological risks and challenges you might come across. Secondly, we have a number of pre-recorded webinars that you can access online. These cover topics that people often ask support with, such as emotional eating, creating new habits, and many more. Thirdly, we offer one-to-one psychological support for those who need it. This is to help with psychological difficulties that are directly related to bariatric surgery and weight loss. Finally, we can help you find the most appropriate service to support you if you have psychological difficulties that are not directly related to bariatric surgery. If you would like to get in touch with the bariatric psychology team, you can speak to any member of the bariatric service and they will let us know. Alternatively, you can phone our office on 01189 044 700 or email us at clinicalhealthpsychology@berkshire.nhs.uk. Please note that we cannot provide mental health support that is unrelated to your weight loss. If you need mental health support, your GP can make the appropriate referral to your local mental health services. In part 1, we turn to discussing the topics you need to know about before surgery. We begin by talking about expectations. Bariatric surgery of any type is a successful tool that can help you by allowing you to lose a significant amount of weight. Your dietitian will give you an indication of how much weight you can expect to lose. This depends on your body type, your genetics, your overall health, and the type of surgery you are about to undergo. While you will lose weight after the operation, it is not likely that you will lose all the excess weight without making changes in your lifestyle. Surgery won't give you an ideal body. Some people have excess skin as they lose weight, and this can cause dissatisfaction. Weight loss is just one of the changes that will take place. For instance, some people will notice that their sense of taste changes, and they may not like foods they used to enjoy before. Your health will certainly benefit from weight loss, but some of your medical conditions or pain may remain. Finally, the operation does not guarantee permanent weight loss. It is normal to regain some weight after the initial period, and without lifestyle changes, it is even possible to put all the weight back. One of the expectations people often have is that they will start losing weight after surgery and that this will continue steadily until a healthy weight is reached. However, the reality is different. The most weight is lost during the first 6 months following surgery. Later on, many factors will affect the rate of weight loss, such as your diet and exercise. Sometimes weight loss slows down or even plateaus for a while. Overall, the process usually continues for about 2 years post-surgery. So how does weight loss work? Your dietitian will give you guidelines on eating, and it is vital that you should follow these to ensure that you get the most out of your operation. It is not helpful to compare your weight loss to others. This is because we all have different bodies, health conditions, genetics and lifestyles. Also, different surgical procedures have different results. So just keep an eye on how well you are doing in terms of being able to keep to the guidelines and advice given. Some parts of this process, such as our genetics, body shapes, and the environment we are in, are outside of our control. Next, we will talk about what the main psychological challenges are that you might encounter relating to surgery and weight loss. Before surgery, you will have already come across the frustration of waiting. However, you can make use of this period by building the foundations of your new lifestyle and prepare yourself for lifelong challenges and changes. For instance, think about what you would like to achieve once your weight starts to decrease. This will help you keep motivated. Also, invest some time and effort into practicing the 20-20-20 rule explained by a dietitian. This is cutting your food up into 20 pence piece sizes, chewing one mouthful 20 times, and eating for no longer than 20 minutes. If you practice this before surgery, it will not cause you so much hard work afterwards. Similarly, think about what types of exercise you would like to do and how you would go about it. Another thing you can do is discussing with your friends and family how they can support you. What would you find helpful from them? A fun thing might be to look for and try new foods and recipes that will help you with your weight loss goals. This and other pleasant hobbies could help you feel good when you feel stressed, so you don't have to resort to food. Another challenge is the liver shrinkage diet that you must follow immediately before surgery. This is a relatively short-term, highly restrictive diet. Your dietitian will give you further details, and we can provide you with an information leaflet about how to manage this diet. Finally, you might have worries about various things such as surgery, recovery, having to make lifestyle changes, life with a different body, etc. Our team has a number of webinars on these topics which you will be able to access. If you are concerned, please get in touch with the bariatric service or bariatric psychology team. Challenges after surgery start with the recovery period. You need to allow your body to recover and also to start your new lifestyle. One of the first things you will have to do is start your graded texture diet. The dietetics team have a lot of information to help you with this. They will tell you how and when to switch from liquid to more and more solid foods. You can spend some time thinking about what you would find challenging about this. Can you think of ways to overcome the difficulties? New eating habits can be challenging to establish. Can you think of what difficulties you might have? We will talk about this in greater detail in the next section. Excess skin is something a lot of people are concerned about. It is not possible to know in advance how your skin will respond to the weight loss. Currently, NHS funding is not available for body contouring surgery. If you do decide to fund a private operation, it is advised not to do this until 2 years after bariatric surgery, when your body weight is stabilized. However, there are some non-surgical strategies to manage excess skin, which you can research later on. Furthermore, some relationships can be affected by your reduced weight. Mostly, these are positive changes, but it is possible that some difficulties arise. If this should happen, you can talk to us at the bariatric psychology team. And finally, coping with difficult emotions without reaching food can be a challenge if eating was a coping strategy before. We have a full webinar on emotional eating, which we advise you to watch if this is a difficulty for you. Next, let's talk about how to make surgery safe and effective for you. This includes creating new habits that help make you the most of the weight loss that surgery will start off. Without making changes, it is likely that you will regain weight after a while, which would have a negative effect on your physical and mental health. Have you already made some changes in preparation for surgery? The more you practice new ways of doing things before surgery, the more likely it is that you will be able to continue with them long term. It is very important to always follow your dietitian's advice. This is the best way to achieve long-term success. One of the important health advice is that you have a structured and planned eating schedule. This means that you need to have relatively set meal times and not skip meals. Immediately after surgery, you may not feel hungry. However, if you skip meals, you will not be able to catch up due to the reduced amounts of food you will be able to eat. If you skip meals, your body will miss out on important nutrients. Later on, skipping meals can make you too hungry, leading to overeating, which would negatively affect your weight and risk weight regain. Think about what it is in your current lifestyle that is not helping you to stay healthy. Can you identify the problem areas? Are there any ways in which you can make some helpful changes? Look at this like any other problem and try to find a doable solution. If you need to speak to us about these issues, contact your dietitian or psychologist. A common issue with weight gain is eating on autopilot. This is when you eat while doing something else, for example, watching TV, working, driving, etc. When your focus is not on what you eat, you miss out on flavors and textures. You might feel a hit when you are full, but often carry on anyway because you're not really paying attention. This makes you miss the body's fullness signals, leading to overeating. A more helpful way of eating is by paying attention to the food and to the experience of eating. By doing this, your food will actually bring you more pleasure because you get to enjoy textures and flavors. The focus is more on the process of eating rather than just that hit at the end. This will also allow you to notice when you are full and can decide to stop eating when your body has had enough. Emotional eating is often done on autopilot. We will only mention it here briefly, but have a separate webinar on the topic if you wish to know more. Emotional eating is when food is consumed in response to uncomfortable feelings such as boredom, low mood, loneliness, or anxiety. Food becomes a coping strategy that makes you feel good for a short time, but causes long-term problems. It is a habitual way of eating that is not due to hunger and does not end when feeling full. Is this something you do sometimes? How often? Do you think it helps you in the long run? An unhelpful way of eating is binge eating. Although some people do suffer from binge eating disorder, it is not a disorder unless done regularly. However, it indicates a certain lack of control over food and emotions. Binge eating is when someone consumes large amounts of food, more than one person would usually eat in a whole day, and feeling out of control while doing it. Afterwards, you feel physically uncomfortable and experience shame, guilt, and regret. Have you ever had this experience? How often have you binged like this? Eating large amounts of food following bariatric surgery can be dangerous, make you feel very unwell, and indicates unhelpful eating habits. If this is a problem for you, get in touch with the bariatric psychology team. Night eating is thought to be linked to the sleep-wake cycle that is a natural daily rhythm we have. It is not necessarily about eating large amounts of food, but it is linked to obesity because the body does not use up the food at night, only store it. This is not the same as having a biscuit before bed, but waking up in the night and eating a quarter of your daily food intake. It is definitely a problem if you wake up to eat at least twice a week. If this is something you do, please contact the bariatric psychology team. The most common eating disorders are anorexia nervosa, bulimia nervosa, and binge disorder. People who had eating disorders previously are more likely to experience disordered eating patterns after surgery. Special planning is needed to ensure that the correct amount of food is eaten. It is also noted that some people become so preoccupied with weight loss after surgery that they put unnecessary restrictions on their eating, which is not healthy. Your bariatric psychology team can advise you about how to cope with eating disorders. Mental health and bariatric surgery have an important relationship. Pre-surgical mental health problems can influence how successful surgery will be. In order to make bariatric surgery safe and effective, mental health problems need to be stable and well managed. This does not mean that you can't have surgery if you suffer from mental health problems, particularly as weight loss can help improve some of these. However, we need to ensure that you can make the important changes after surgery to maintain weight loss. Some of the issues that need to be addressed are low motivation to exercise or attend appointments, which is particularly common in those who suffer from depression. Another example might be needle phobia that can prevent you from accessing medical care. Obsessive compulsive disorder can interfere with food preparation, excessive public gyms. And finally, feeling anxious in social situations can make it difficult to use public transport to attend hospital, go to the gym, join exercise groups or online educational groups organized by the bariatric service. Mental health after surgery is also very important for your quality of life and successful weight loss. For a lot of people, bariatric surgery and losing weight leads to an improvement in their mental health. However, this is not always the case. After the initial honeymoon period, things can change and the realities of post-operative life can be difficult to face for some. We know from research studies that some people experience suicidal thoughts or a desire to harm themselves. As before, it is important that mental health problems do not interfere with your quality of life or your ability to make lifelong lifestyle changes. For instance, similarly to before, depression can reduce your motivation to reach your goals. Anxiety can prevent you from trying new things like a different way of eating, new forms of exercise, or new hobbies. Social anxiety, poor body image, or low self-confidence can make it hard to engage in exercise outside of your home, which can reduce your chances of lasting health habits. If you have been prescribed and been taking medication for your mental health, the absorption of such medication will change drastically after surgery. You must discuss this with your GP or prescribing clinician. Please do not change the dose or stop taking your medication without talking to your doctor. This could make you feel unwell and seriously destabilize your mental health. The recommended limit of alcohol consumption is aimed at giving us an idea of what we can drink without harming our health. Speak with your dietitian or psychologist if you think that you regularly drink more than the limit. Following bariatric surgery, absorption of alcohol changes drastically, particularly after gastric bypass. You are strongly advised to reduce or stop alcohol intake both prior to and after surgery. The risk of developing alcohol dependence is very high after surgery. You must stop drinking alcohol for at least 12 months after surgery to prevent this from happening. If you think that you will find this difficult, please talk to your bariatric psychology team. If you would like more information about the topics covered in this webinar, we can recommend the book Living with Bariatric Surgery by Denise Ratcliffe. This is the end of the presentation. Thank you for your attention. We hope that you learn things and you will find them helpful. If you want to talk about any of the topics we mentioned, get in touch with the bariatric psychology team. Finally, we would like to wish you the very best with your upcoming surgery.